Carol is going to talk about some of the issues surrounding the coronavirus epidemic, pandemic, whatever we want to call it, and in particular some of the issues regarding the way in which it's been dealt with. Carol, you are a vet by profession, you know quite a lot about viruses, you know about the impact of viruses. Tell me what your reaction was when you first heard about COVID-19.
Okay. Yes, it was interesting because we could hear some stories coming out from China quite early on in 2020 through January and February in 2020, and there were certain movements and different things were happening that seemed slightly out of kilter to what would seem to be a normal response to a respiratory virus, because we know that respiratory viruses do crop up and we know that in the winter months they will reach a higher rate than usual. So it seemed as though there was a bit of an overreaction going on in the stories I was hearing, but it didn't really come to a head then until it started to crank up in the news through March, and then the first restrictions kicked in, and I was extremely alarmed by that. It certainly felt that there was no likely strength of virus that could result in such a change of tactic for a UK government to make within what we understand to be a democratic nation, where normally we do things by consensus and by voting in certain policies. So it was a big shock when the first restrictions at the end of March were announced.
Yeah, well, the thing is, Carol, I hear what you're saying, but obviously the virus has been quite severe. A lot of people have been have suffered because of it. It's caused deaths here and around the world. So what would have been the alternative for the government to what they did to lockdown?
Yes, it was interesting because we do understand that governments do have guidelines and templates and management tools already in place where a pandemic or disease process may occur, and these things have already been written and policies have been studied and thought about for years, and we've had some little scares before with the previous SARS pandemic, so that stuff was already written about, and it did not contain the tendency to cause the whole country to be, as we've now called it, locked down. That, however, is a version of quarantine. So it's understood that if you have a group of ill animals or humans and you are able to contain them in a quarantine, then that may prevent further spread of the disease to healthy others and allow you to modify what's going on with that group of people. However, what these restrictions have become is not quarantine in its sensible sense or true sense. It's become a control mechanism for the larger part of the population when we already can identify the at-risk groups within the population. There are demographics and very identifiable at-risk groups. So whilst that could not perhaps have been quite so clear at the very beginning last year in March and April, it started to unfold and become clear even as April managed to unfold. The medical people were able to identify their demographic. Plus, the people who were in hospitals or care homes were already in a form of quarantine. These were not the people going to the shops and so on. So there was certainly a disproportionate reaction causing a restriction on the whole population against what the science and the medical outcomes were showing us even as early as April last year.
So even if we allowed some scope for the initial lockdown, which we probably can see as a panic reaction on the part of the government, would you say that there was any justification at all for the subsequent lockdowns that we've seen? I think we're on to at least the third one, possibly fourth one now. Is there any justification for these lockdowns at all?
I can see no justification for the subsequent lockdowns. It seemed that the vast majority of people, even those of us who were not in favour of this and were alarmed by it, would have been quite willing to go along with the initial one, the 3 weeks to flatten the curve. That was ample time for certain extra structures to be formed and extra precautions to be taken. after that, the different lockdowns and restrictions were rolled out, calling them different names with different tiers and different cities and different ways in which it was done. And the whole thing, to anyone's understanding, has been so unfathomable and messy, it really doesn't make any sense. And it certainly does not seem to be a systematic method of really identifying where the disease was going and who was catching it and what was happening to them. It seemed a completely never-ending set of new rules and regulations to confuse people rather than to protect them.
That leads me to one area which certainly is of deep concern to me, which is the amount of money and resources that have been spent on creating fear. I mean, obviously they've employed some very expensive psychologists to continue to create fear within the population. What's your view on that, as somebody who is, albeit with animals, a clinician themselves?
Possibly that's, for me, amongst the most alarming thing of all, and I find it very saddening and deeply disturbing. It is known that there was a document produced as early as last March 20th, I believe, the APPEASE document from the SAGE Scientific Advisory Group for Emergencies. These were the people who were involved in forming policy and informing government. The SAGE Advisory Group at that time consisted mainly of mathematical modelers and behavioural psychologists, and the initial group did not contain epidemiologists or virologists, yet these were the people who were forming guidance and guiding the government into what to do next. So it seemed very clear that behavioural psychology was behind it. The APPEASE document specifically said that people were not afraid enough, that some people were complacent, and that a purposeful campaign using media and social media should be implemented to ramp up the level of fear in order to gain more compliance. That campaign has been quite relentless and very successful. The posters that were up on the walls on the billboards through winter were quite disturbing and scary and showed a lot of misery and sadness through the virus. And most caring normal people could only be affected by that. And now we have a population of people who are afraid of other people, afraid to make contact, afraid to visit relatives. And it's like a national psychosis, which will take, I think, a lot of work in terms of, again, behavioural psychology to help people lose their fear and come out the other side and be relaxed and okay again.
But having said that, they tell us that there are these numerous variants, the South African variant, we now have the Indian variant, we had the South American variant. You've given me a view previously on the whole issue of variants as far as viruses are concerned. Could you just summarise what you feel in that respect?
So we do understand with all viruses that they'll mutate and vary from time to time, and then these will be studied, and those viruses that are dangerous to animals or people will be studied so that perhaps we can stay ahead of any nasty or dangerous variant that might come about. Respiratory viruses are very inclined to change. That's the nature of how they're able to prevail season after season. The new variant stories that have come out since the COVID-19 initial novel coronavirus, as it's called, these stories seem to be exaggerated and changed in order to just give us all something more to think about and something more to be fearful of. And I do find it interesting because you can have a variant that's from somewhere as tiny as the county of Kent and another variant that apparently comes from all of Brazil. We just call them names. I've seen some government documents about the variants and trying to quantify the extra risk of the variants, and there is use of words and use of statistics to certainly give an impression of an increased danger from the variants, even though it is known that the increased risk of death or serious injury, or what you might describe as more rapid transmission, whatever that's supposed to mean, these things are not quantified and are not proven. The new variants are a wee bit like having a litter of Labradors, where one's yellow, one's black and one's chocolate and one's red. They're all still Labradors, and they might not be exactly the same in their temperament, but it does not necessarily mean that one is more harmful or can necessarily run faster than the other.
So on that point, I mean, we're now told that India is a major hotspot, and deaths are climbing at an alarming rate, etc., etc. What's your view on the way in which situations such as India in particular are being portrayed at the present moment?
It seems inevitable that as the viral risk and viral prevalence in the Northern Hemisphere, where we're coming into spring and summer season, the viral prevalence will inevitably reduce to near zero, and currently that is the case. So therefore, if we're trying to keep the fear machine going, then we have to focus our attention somewhere else where the virus may be more active. In India, 27,000 people die every day on any given day. And currently, if you look at the statistics of how many people are actually dying from coronavirus per million, it's something like 100 people per million.
147 is the current figure.
147, yeah. So under 150 people per million, which is still 150 people, but in a country or a subcontinent the size of India with their billions population, this is not an extreme number, and there are many reasons why people may pass away to do with demographics. It's been shown very clearly in the Scotland figures that the lower social quartile in Scotland suffers the highest number of deaths from COVID-19 even here. In other words, if you are less well off, you are more likely to suffer a severe outcome. So if we look at India as a population where there are some very wealthy and a vast population of extremely poor people, that's going to make a difference to the death numbers as well. We've never had a situation before where the UK news was reporting illness and death figures from the Indian subcontinent on a daily basis, and suddenly we are now. There are many countries in the world suffering many different problems for many different reasons, but the news cherry picks the stories that the news wants people to see in order to completely keep going with the fear agenda.
Which is evidenced by the fact that out of a population worldwide of 7.8 billion, we just recently reached 3 million COVID deaths, some of which we now know probably weren't COVID deaths, which is 0.04% of the population, so that kind of confirms the point we're making. On that subject, it was announced today that 20 million people in the UK are in areas where there was no COVID at all during April, not a single solitary case. So where does that leave us as far as lockdown is concerned and the justification for continuing lockdown?
One of the things that I think would be helpful and perhaps is a source of slight disappointment would be that the general population does not tend to ask questions very deeply, tends to think only where they've been told to think and do what they've been told to do, and try to do that for the right reasons, because you're placing a certain element of trust in certain directions. There's nothing wrong with that. However, you don't have to work very hard or look very far to start finding the numbers, or even if you look out your window and see what's going on. The reality is we're not seeing mass death rates, and people have lost loved ones, but they understand that the loved ones they've lost often had underlying conditions. We've got, generally speaking, a much better understanding now than we did before, and the figures are well available for people to see. Therefore, it cannot be justifiable when the figures are so low in terms of illness and death that people are still willing to stay in, not operate their businesses, not go and visit their friends and family, and have people round to do all the normal things like go out for a cup of coffee that we used to before. There can be no justification for it continuing. This should stop right away, right now, today, in all its forms.
And on that subject, the Freedom Alliance, the impression is given that Freedom Alliance are anti-vaccine. Now, we've previously had a discussion on that, and I know you're not anti-vaccine, but what you do have is questions about the current vaccine. Having said that, 34 million people in the UK have now been vaccinated. There's increasing evidence that the vaccination programme is actually having an impact of some sort. What is your overall view on vaccination, and in particular on the COVID-19 vaccines?
So neither myself nor the Freedom Alliance is an anti-vaccine organisation. It's pro-choice and pro-giving good information so that people can make informed choice regarding their own health care needs and their own bodily integrity. And that would be clear from our materials, and also I'm in the business of giving vaccinations, and I can see the great benefits that come from vaccinations. So vaccinations, great idea. What you should always be taking into account is, what is my risk of catching this illness? What is my risk of a severe outcome from this illness? What is the benefit I can get from the vaccine? The vaccine agenda programme has been, again, quite relentlessly driven without paying particular attention to the identification of the at-risk groups, the identification of how much of a benefit the vaccine could give to those people, and without any real attention being given to well-known and well-tested protocols now for treating COVID-19 and SARS-CoV-2 as an illness should a person suffer from the virus and become very ill. So here we have got a virus for which the vast majority of people will recover, most people won't catch it. We're talking about asymptomatics, carriers and asymptomatic transmission, which is absolutely not proven to be a real danger or a real thing, using PCR tests which have been acknowledged to be flawed in their use and their rollout. So we've got this disease, most people won't even catch it. Of those who catch it, most people won't become very ill, and even those who do become ill, most will still recover. Of those other ones who are struggling, there are treatment protocols available. Therefore, it can't be argued that a vaccine is essential for the whole of the population, and it does seem as though the attention and the money is being directed in a rather unfortunate direction, which is not going to benefit the majority. And certainly, the Freedom Alliance is absolutely against any indication or suggestion of using some kind of passport and causing people to feel compelled to have a vaccine for that political reason.
So in terms of vaccine passports, and I mean obviously that is a very contentious issue, there is still going to potentially be insistence on vaccine passports overseas. So if people do want to travel overseas, it's probably a wee bit like, you have to get a yellow fever vaccination for going to certain countries. What's your view on the whole issue of international travel and the extent to which that has first of all been restricted, where we've been told quite categorically we're breaking the law if we travel abroad, but looking forward, where do you see things going as far as international travel is concerned?
The international travel restrictions, as I understand it, are described in such a way as to make people very reluctant to travel abroad, and yet now we hear of some people travelling without having too much difficulty at all. There's just far less of it. It seems as though the people should decide. It seems as though the people should be allowed to be given informed choice. If we're saying that you can't go to a red country because there's an outbreak, what does that mean? Countries are massive. Is that an outbreak in a particular town or city, a district, a region? Is it the whole country? To try and restrict travel using a coercive vaccine in order to get a passport, so that we're dividing in some kind of medical apartheid to those who are vaccinated against those who are not, seems a very slippery slope to go down in terms of societal management, and seems very unnecessary from the point of view of disease management. Therefore, as a form of political control, I would ask the question, why? Why is this being introduced? Who is benefiting from that? It certainly does not seem to be the ordinary people who would benefit from it. Presumably somebody is.
Carol, one of the issues that we discussed was the issue of flu and the fact that flu has all but disappeared, which seems somewhat strange given the general environment we're in at the present moment. What's your thoughts on that?
Yes, it is interesting, and certainly I don't think that flu has disappeared. One place to look would be to the testimony of our Freedom Alliance lead candidate for Mid Scotland and Fife, Lisa Breckenridge, who was on with David Scott, and she was explaining something called a protocol that is done in hospitals in the winter when patients are admitted with respiratory signs. They'll go through a tick box to try and figure out if that's likely to be influenza, because presumably then these patients require to be nursed in an isolated way so that that's not passing the infection to staff or to other people. So my understanding is that there was an influenza protocol that was done routinely. However, Lisa reported that those protocols were not being performed with the admission of suspected COVID cases, and this is one of the things that she's questioned and explored. So if you look for a certain thing, if you apply a certain clinical sign and do a certain PCR test and look for a certain thing and only want to find that certain thing, then you definitely can do it that way. If you stop looking for other things, then you won't find them. It seems very improbable that influenza has gone away, and it also seems highly probable that those people who had COVID-19 symptoms had also paralleled influenza symptoms, and if we're not asking questions specifically, then we're going to find only a particular answer. I would say no, influenza's not gone away, but we're just calling it a different name in some cases.
So effectively we're getting the answer that we want as opposed to the correct answer?
The correct answer requires exploration, and I wouldn't like to say it's not the correct answer, but certainly what I am saying is that figures and tests and what you look for can be swayed in a certain way if you want to sway it in a certain way, and the ways that would balance out that particular methodology have been stopped for the time being, which is interesting. It seems likely in the face of a novel virus that bigger questions should be asked so that more could be found out, rather than categorising individuals as a COVID death when there's a great deal more going on. And it does seem as though the information that's been given to the members of the public is not the full, accountable, interesting, manageable and useful information that people deserve and should get to see in order to make informed choices regarding their behaviours throughout this now endemic virus.
Now, to me, it seems very, very illogical that you can drink outside, you can't drink inside, you can have 4 people inside, you can have 6 people. I mean, the whole thing is extremely confusing. Is there any science at all behind this? Because we were told, first of all, it was all about the science and that we were following the science. Then we were told we're following the data. Now, the data is very obvious. The data is that very few people are even catching COVID, much less dying from it. So where does this all sit? There's so many contradictions in here about, as I say, following data, following science. What are we actually doing?
Well, again, it's really a good question in as much as it is an unanswerable question, so that if you can now look back upon more than a year's data and the figures are there and they don't lie. You cannot be maybe dead or maybe not dead, you cannot be maybe recovered or not recovered. We can see what's happening with people in terms of illness and death and recovery and so on. We can also see what's happened to people with regard to businesses being lost. So figures are out there now, the data is inarguable. In terms of the question, what do we do with that and how logical is it? It clearly isn't logical, and it is in that lack of logic that should make really any ordinary person question what the agenda is. It would be really interesting to see, and a question that we should reasonably ask, to say, bring me the data to show me that drinking alcohol before a certain time of day and not after a certain other time of day, or being inside or outside, or what constitutes a big enough space and how many people should be in a protective bubble. It'd be really interesting to see the data that backs up any of that, and I think there is none. And until some can be brought, then it is always held up to question as a simple hypothesis that somebody pulled out of the sky and said, why don't we do this, why don't we make it 6 people? Show the logic, show the data. There is none to be shown. I'd be very happy to see it if someone could bring some forward.
So if there's no data, what is the objective behind doing things the way they're being done? I mean, given the low number of cases, why don't we simply reopen the economy, let people get back to work, let hospitality get back to the things it does, let sport get back to a reasonable level, even if it's with some form of social distancing? Why wait till, I think in England, June the 21st? I'm not even sure when it is in Scotland. Why are we waiting so long?
I have no idea why we're waiting. It doesn't make any clinical sense to me. It doesn't make any economic sense to me. It certainly doesn't make any psychological sense to me. The sooner we can actually start letting people relax and get back to normal, the less further levels of damage can be done, and it can't be a minute too soon as far as I'm concerned. I can see no reason for continuing with any form of restriction personally in terms of disease spread. There's nothing that we can't cope with. We've got treatments for this disease, we've got hospital places for this disease, we've got understandings for this disease, we've got identification of those who are vulnerable for this disease, and we've had a vaccination rollout. There can be no reason for any further restrictions. They should end right away.
Thank you very much, Carol. Thank you.